Several weeks of COVID lockdowns in Shanghai are now creating a ripple effect being felt all the way here in the United States and our healthcare system. A dye used for scans, everything from x-rays to MRIs, it's manufactured in Shanghai, is now running out. In our HealthCast today, we take a look at what that means for patients here. An unprecedented COVID-related supply chain issue is now forcing hospitals to ration care, all because of a severe shortage of IV contrast.
IV contrast is fluid that we put into your veins so that it increases the obviousness of abnormalities within the body. Sometimes it's a nice to have, other times it's essential.
Industry analysts say China's zero COVID policy has turned into a supply chain nightmare, leading to shortages.
A lot of places are somewhere in the 2 to 3 week range. I've heard some places as low as 1 week in terms of the amount of CT/IV contrast that they have on hand.
Professionals are dealing with it, but it's not an understatement to say that it is a crisis and it's a problem.
Some health systems have been forced to temporarily pause scheduling outpatient CT scans that require the contrast.
If we're doing that same exam without contrast material because the supply simply doesn't exist, it may be that we just miss a cancer, or we diagnose a cancer later, or we're not able to see the extent of the cancer. And these are real potential harms.
It's going to be a big problem, and some estimate it could actually be the end of June or maybe well into summer before supplies are back to normal.